Welcome. I'm Eric Youngstrom. I'm the co-founder and executive director of Helping Give Away Psychological Science, a nonprofit organization dedicated to bringing the best information about psychological science directly to the people who would benefit. This talk and recording are the last of a series of 5 in HGAPS inaugural speaker series. So we've had 4 other talks already, and it's my pleasure to introduce Dr. Teri Bourdeau, who is the Vice President for Outreach and Education of PracticeWise. This talk was made possible by a generous grant from the University of North Carolina at Chapel Hill's Student Government Association, and I would like to thank them and Taylor Steele and Caroline Vincent, the treasurer and the president of the UNC-affiliated chapter of Helping Give Away Psychological Science. They wrote the grant, they defended the proposal, they secured the funding, which has made this speaker series possible. So that's fantastic. You guys go. Also want to thank the North Carolina Psychological Association, which reviewed the live version of this talk as a continuing education event. And I would like to thank Helping Give Away Psychological Science for the work which it's done to put together the series and the other resources. Dr. Bourdeau is going to talk about PracticeWise and about what evidence-based practices in psychology have to offer as clients and students are dealing with anxiety, depression, trauma, stress, the common mental health issues that often have been worsened by the COVID-19 pandemic and by the social isolation and distancing that have been important public health policies in trying to deal with the pandemic. PracticeWise is a corporation that is built for impact, not empire, is a catchphrase that they use a lot. So this is an organization that reviews the information about psychological practices, assessment and therapy in particular, with a focus on children and adolescents, but with application to adults and other age groups as well. PracticeWise was born in projects in the state of Hawaii, and the lessons learned transformed the system of mental health care in the state of Hawaii. It didn't stop at Hawaii. It's been spreading, and it's had a transformative impact on towns and counties that you may have heard of, like Los Angeles, California. PracticeWise has continued to grow, continued to review the evidence and build tools. It's a subscription-based system. What I was delighted to learn, though, is that many of the resources and the information that they're gathering is available for free, with free subscriptions and several other ways that Dr. Bourdeau is going to describe. So without further ado, it is my delight to introduce Dr. Teri Bourdeau, talking about the best evidence for helping clients and students deal with stress, anxiety, depression, especially as we're all navigating too much Zoom and the COVID situation. Thank you, Dr. Bourdeau.
I do want to quickly acknowledge the folks that Eric and Caroline already talked about. Really thankful that they would invite me to be here, and also just disclose that I'm an employee and passionate advocate of what we do at PracticeWise. So I think that'll come through in my talk. I always said I was not born to be a salesman, but I somehow sound like it at the end of the talk. It's like it's compelling. I try to compel and inspire, but I'm very excited about what we do at PracticeWise. Quickly, my presenter pre-ramble is Teri Bourdeau, Vice President Training Development at PracticeWise, and from Oklahoma. Just give you a little bit of background, because I think sometimes it's nice to know who's speaking to you and what right does Teri have. I'm not really sure some days, but I got a PhD at the University of Tulsa. internship at Vanderbilt, and then went on to postdoctoral fellowship at University of Oklahoma Health Sciences Center. Background strongly in pediatric family health psychology, very passionate about anything, you know, medical, physical that touched any of the lives of the patients I saw. Was associate or faculty, assistant professor at at Oklahoma State University, not University of Oklahoma. I'd be in trouble for that, and this is going to be recorded, isn't it, Eric? Oklahoma State University, Center for Health Sciences, the Cowboys there in Oklahoma, and director of behavioral health clinics. So in saying that, I just say I saw a lot of folks, kids, adolescents, transitional age youth, adults, elderly. We kind of saw them all and worked with a lot of medical providers, healthcare professionals on multidisciplinary teams. So that's part of what informs what I do. And I joined PracticeWise full-time I've been with them since like 2009 as a consultant and trainer in MAP. I'll talk to you a little bit about MAP. We do have Match as well. And then joined them full-time to come in here because I just felt like I could impact even more youth lives if I could train folks all over the United States and really all over the world. We train and we have users all over the world of our products, how to use evidence to inform practice. So without further ado, that's about me. I'm curious if folks, I will do a little housekeeping. Please feel free to come off mute. This is a very lonely situation when it's just you talking. And it's not very engaging, right? This is not what we want to do with our youth. And yet here we as presenters, that's what we do. And in the Zoom world, we do a whole lot of it. So I welcome and invite. I've got the little screen up here on the left. So I'll try to look at the camera, but I got 2 monitors. I'm going to try to see if somebody raises their hand. Feel free to come off mute. Doesn't bother me at all. We train a lot online. One of the adjustments we had to make a year ago. And so I welcome and invite questions, and you can also feel free to chat over. So before I get started, I'm curious, Eric mentioned PracticeWise, that's the organization that I work for. I'm also on the board at HGAPS, so very passionate. And I am going to talk to you about some of our free resources today. So what I would say about that is if you'll hang in and stay tuned, there's kind of a lot of free stuff at the end, but I have to kind of do the buildup, quite honestly, so you know what they are, like, and why we built them and what they're about and what evidence they're built around. So how many folks have heard of PracticeWise? Just curious if you want to chat, raise your hand or do the yes, what we do. I like to, Eric's like, yes, I have heard of them. Other folks, Emma. It's always kind of nice to know, you know, folks have heard of it. No, this is helpful for me to see this. No, yes, yes, a little, no, not familiar. Because what I would say is that's fantastic if you don't know anything. For folks that know a lot, you may be like, wow, you just reinforced what I know. Or maybe I gave you a little bit more information that you didn't know. But for anybody who doesn't know, worry not, because I'm about to tell you I'm about to give you a story, like Eric said, that was kind of born and conceived in Hawaii. And really born to really improve system of care. So the agenda today is really setting the stage. Why are we here? I'm going to do a preface on evidence, what evidence, why evidence. PWebs, I want to tell a database story and how PWebs was built and why it's transforming what we do in youth mental health treatment. We'll talk about the toolbox. There are lots of tools. You guys came in with toolkits. You have your toolbox, you have your tools. And one of the things I want to say at the top of the presentation is that everything I'm going to talk about is complementary to what you're already doing. I'm not going to come in and say this is the only way and the way. These are more tools, and in fact, it is a system. It is in a sense kind of a full toolbox with which you can put your own tools in there. So I'm going to talk about some of those free ones, and then we're going to have an ending, but it's not over. It's not over ending. So we did decide today that I would also talk about how the MAP system, the core resources, what we do at PracticeWise, how it really has helped us help providers manage and plan for what to do in a pandemic situation. So hopefully I can take you through some activities that will help you see that too. Everyone's coping right now. Maladaptive, adaptive, doesn't matter, we're all coping. So that's part of why we're here, is because we want to see what we're doing well, what we can do better. So I just want to kind of briefly, for anybody that was at the ABCT talk, Bruce Torpeda, the president of this company, was president of ABCT a couple of years ago. He showed this slide about before COVID, and we didn't know there was going to be a COVID when he showed this slide. So I put before COVID, roughly 20% of the world had a mental health challenge at some point. Most people with mental health needs receive no services. The vast majority is not evidence-based. About half of those who receive evidence-based treatment drop out. So stay tuned on that one, because that's why I'm going to talk about all of the tools we have that try to really address some of that. We have an insufficient workforce to meet the world's mental health needs. So the vast majority is not delivering evidence-based, and then we don't even have enough folks to meet the needs. And the global cost is estimated to be $1.5 trillion. And, I'm sure everybody in the behavioral health world right now knows tons of money is being pumped into behavioral health right now in all kinds of ways. I think there are probably more startups since COVID than probably in the history of behavioral health, tons. So what's the goal? At PracticeWise, this is our goal. I think that it's probably the goal of most folks on this call, that we want to transform lives. We want people to be healthy, stronger. We want to alleviate human suffering. I think we'd all like to be out of a job. That would be a lovely thing, to have to go figure out what else I was going to do. And to advance how evidence and information are used to improve the lives of children and families, which is our primary mission at PracticeWise. Again, please feel free to speak up. I'll try to monitor my chat in case folks have questions. All right, and bear with my tech. Every once in a while, if you toggle off, you can't get to your cursor. So the why are we talking about this today and in the context of COVID is youth are struggling. I would venture to guess you're all seeing that right now. Youth challenges can easily become bigger adult problems. So one of the reasons I'm so passionate about youth mental health is if you've ever seen adults who've had problems since they were young and they said, oh, I've seen 3 therapists, and you asked them what they did and they said, well, he was really nice or she was really nice. We talked. Oh, great. What'd you talk about? What skills did you build? Oh, I don't know. I mean, they listened to me. And here's this adult in your office. So that's not getting any better in COVID. I would say pandemics are stressful on most everyone. Anybody else agree? This has been a little bit of a challenge for folks. How are you guys feeling being on Zoom right now talking to me? I'd much rather be in person having a conversation. That's why I'm so thrilled you're actually here. I told Erica, who's going to come at 7 o'clock at night to Zoom when they've been on Zoom all day? So it's been pretty stressful on all of us. And we need solutions that work, or we're going to have an even bigger problem than we already do. So I think that we all can agree with that. The youth you currently see, oh, and I just realized you might have this black box I need to move. I apologize for that. I realized the video when it is on may have been a black box on your screen, so I apologize for that. The youth you currently see, some of them had anxiety, depression, trauma, disruptive behavior, inattention before COVID, right? How does the pandemic impact their current functioning? How is it exacerbating symptoms? Is it ameliorating symptoms? For our kids with social phobia who don't want to go to school, how are they doing right now? It's good. Like, I don't have to see anyone, right? But that could be problematic later, right? Plans have been disrupted. Kids are home every day, starting to go back. Loss of in-person support systems. But there's some good things, new opportunities to grow and learn. I think we're also being given new opportunities. And the list goes on about what's going on with the youth that we're seeing. So a sample treatment plan might look something like this. And if you are familiar with PracticeWise, this is the focus interference framework. We teach this, actually it's 2 coordination models, focus interference framework, and also the connect, cultivate, consolidate. That concept of let's have a really strong therapeutic focus so that, and let's plan for those kinds of things that could interfere. Sometimes we know up front there are things that could interfere with our plan. Sometimes they come along as we're seeing the youth during the treatment episode. But in our world, this is called a treatment planner. And in our treatment planner, we might have, planned to do engagement, psychoeducation on depression, and then we're going to cultivate these skills of activity selection, problem solving, relaxation, cognitive for depression. We're going to consolidate with maintenance, relapse prevention, perhaps in our plan. But we also know the youth has some disruptive behavior. So we've identified, we know that evidence-based treatments show that commands, timeout, maybe some praise, active ignoring, lots of different practices we might identify to help them. So I'm just kind of giving you a context of this was going on pre-COVID, right? So your first question in treatment then, or even now, is what do I do? So one of the things that we talk about at PracticeWise are that there are multiple sources of evidence that can help us decide. So we know a lot from the evidence-based treatment literature. Most people on here are probably well aware of some of those evidence-based treatments for disruptive behavior. Have you heard of parent-child interaction therapy, positive parenting, triple P, many, or anxiety, the coping cat might be one. Match, a modular treatment approach for anxiety, depression, conduct, or disruptive and trauma. But we also know that, to the point of the slide, is evidence-based treatments, people drop out, they don't all stay engaged, not 100% get better, right? They may have anxiety, trauma, depression, we got lots going on, right? So we know that's one source of evidence. We also, might look to, during a pandemic, we don't have a research on COVID, not yet, it's going on now. Lots of money being pumped into that. But we have research on natural disasters, epidemics, community youth responses. We know things about resilience and risk factors literature, normal reactions, timeframes. You also have a local aggregate or practice-based evidence that you used. Many of you have seen something similar maybe in the work you do. Maybe you have information about how youth, similar youth in your practice respond, your local aggregate. And then of course, the youth standing in front of us or that family, pre-existing kind of symptoms, the plan that you had, what was their response to the plan, strengths, etc. So I'm going to talk about a specific resource that really is around the evidence-based treatment literature. But I always try to hold out there, we understand, and when we train and teach, and I think many of you would agree, that's one source of evidence. It's a really good one. It's a great place to start, but we need to consider the other ones too. So youth mental health treatment, what do we know? There's much data about what has worked for certain youth in these treatment studies. It's a great place to start. Easy to search and find common practices. And like I said, combining with other sources can help guide the selection of interventions that may be useful. Why the focus on evidence-based? Well, one of the things I usually say in training is if I get cancer and I go to the oncologist, I don't want them guessing, and I don't want them trying to talk me through getting rid of cancer. What do I want? I want, what's the latest science? And what do you know about 50-year-old females, like in Oklahoma or like in Florida now? It's like, I want them to know and bring evidence forward to try to help me have the best treatment plan. So what we know is that evidence is frequently available. It's infrequently used. I don't know if that surprises anybody, but it's true. It holds us accountable. I always said as a supervisor, it was much easier for me to justify what are my students doing, what am I doing? It does help us set priorities. We talk a lot at PracticeWise about, we don't have all the answers, but we give ideas and we try to help people find good evidence-informed ideas. It helps us make better decisions, and hopefully it helps youth get better faster. So one of the things we know is there's no shortage of it. There have been a tremendous number of randomized control trials in children's mental health, demonstrating beneficial effects of many, many interventions. But we have a lot of data. Anybody tried to read all of those evidence-based treatment studies? Anybody read a lot of them and still feel like there's so much that you don't know, right? So we have a lot of information overload. So what PracticeWise did before my time at PracticeWise, but after the time I was in Eric DeLayden's lab as a student at University of Tulsa, is they realized, and Eric was talking about this, kind of came out of Hawaii, where they had an issue with the mental health system, and they had to get better treatment. They had to get providers using better treatment. So what they recognized is providers could not be trained in all the evidence-based treatments. And they were evolving, right? We're creating new ones. We tweak it here, we tweak it there, we study it again. So what's the best? How do I keep on top of that? So the literature basically was coded. Division 12 APA has kind of coding criteria. I'm not going to spend a lot of time, but I'm happy to answer questions afterwards or talk to folks offline, email. But the literature was coded in 11 target areas for youth. And I'm going to walk you through a little bit about that coding and what results you get when you search this database. This is called the PracticeWise Evidence-Based Services Database. It's a database of youth treatment literature summaries. I will, from now on, call it PWebs for the rest of this. So when I'm talking about the PWebs, this is that database story I was going to tell you. What you'll see on the screen in front of you right now and is an example of one search, just a piece of it. You can't see the whole thing, but I'll show you more of it in a moment. And you can see in this search, we have put in anxiety. We're going to look for the problem type anxiety. We want studies that included 12-year-olds. We also want studies that included males. And we want studies that demonstrated to be level 2, good support or better. So we didn't just say level 1, best support, harder to get there, harder to be at that level, but there are also studies that have achieved level 1, good support or better. But we thought level 2, good support or better, that's good enough. And you'll see that it returned 59 papers that met that criteria. And that in those 59 papers, there were 82 protocols, just meaning obviously that there were more than one protocol in some papers, comparing them to each other. So let me walk you through. Again, stop me if you have questions, and I'll try to keep an eye on the time. It seems like it goes so fast. PWebs is a searchable database. It helps you find which treatments are effective, common practice of those, other features of effective treatments, and primary sources of the information. But let me make it clear, we don't give you the papers because that would be copyright infringement, but you do have the references or the bibliography for all the papers that are in there. Let me just quickly kind of go through this. You'll see like you can search by treatment protocol if you're curious if a treatment protocol has been coded and is in our database and how it leveled, what measures they used, how we coded that. You can see treatment practice if you're like, I wonder which one, what's mindfulness, what's activity selection, what's engagement. You can also see the research papers, again, the references to those, and you can see the parts that have been coded from those papers. 11 problem areas currently are being covered in the database. So you can see that, there's primary anxiety, depression, disruptive behavior, trauma, but also things where, fewer studies appear at the current time, but things like suicidality, substance use, again, in the youth literature, there are fewer than in the adult literature, mania, elimination, etc. I will mention here, just make a note, we have, that's one version of the PWebs. We also have a PWebs that's coded in CANS language as well, for folks that have questions or are interested in that. But again, in the interest of time, we can't cover it all. So what you get is you get search results that tell you the treatment families, what % of groups were a certain treatment family. You get to see the setting they're in. And that's really, fun for our providers. We have more and more school-based providers we work with and we train, and they're curious, was this ever tested in a school? And more they are, because we have more and more school-based providers. Eric was talking about LA County. So we're in one of the nation's largest schools, LAUSD. Clinic, other, and this search doesn't show it, but residential, other community field comes up. You can also see what % of the groups used which type of intervention format. And then of interest to many of our providers is, what did they do? One of the things I say about anxiety, as you guys are probably well aware, is anxiety comes up, between like 85 and 95%, depending on how you search and what criteria you use, or exposure comes up. And I always say, if you don't have exposure in your treatment plan, you need a pretty good reason why not. But you can see it's 90% of these protocols. So 10% of them didn't have exposure on there, interestingly enough, but it must be pretty potent if it came up 90%. You can see then 67% of the groups of those 22 papers in this search, the way we searched it, used relaxation. 63% of those groups used cognitive, 57% psychoeducation for anxiety for child parent, and so on and so forth. I'll talk to you in a minute about, like, this is one source of evidence, and we'll talk about a little bit about how we try to help folks sequence them and put that together. So this is just a little slide that says, hey, we've got lots of individual kind of name brand treatments, but we can learn a lot by coding that and seeing what practice elements, for an example, are common to those. Now, I want to be clear, this is not comprehensive and incredible years PCIT. It's just a way to show some of the practices that will show up in these parent training treatment family specific protocols. One of the other things, this was a pretty compelling slide. Bruce Sharpita, again, president of PracticeWise, professor at UCLA, showed this slide at ABCT, so I got to give him credit for that, and also the authors, Kelsey and Trina and Brad and a lot of other folks that studied this. But what it shows is that we continue to create new protocols, and you can see that line just continues to grow up. But the number of new elements you can see is kind of leveling out. We're not finding a whole lot of unique elements. People are just continuing to create new protocols. So one of the arguments might be maybe our focus should be on how we get the most out of the treatments that have been done and start studying that as opposed to continuing to create a new protocol. All right. So one of the things, so the second question, I'm getting to the free resources, because PWebs is not free. You have to have a subscription to that, like you would, have a subscription to like an association. But how do you do the practice? So the other thing in PracticeWise that we have are what are called practice guides. We have 2-page guides on 60 of the most common practices. We continue to update these as the literature updates. And we also create new ones as a practice element warrants creating a new practice guide. These are taken by taking one kind of generic common approach to taking all the protocols and saying, hey, what would be a common approach, for example, to motivational enhancement? Practice guides are useful in a lot of ways. In training program, for learning it to begin with, for refresher knowledge. I oftentimes, if I didn't use a practice guide a great deal, might just have it there with me, have the checklist so I can just refresh and make sure I wasn't missing a step. Sometimes we think we're doing relaxation exactly as we're supposed to. It doesn't seem to be working. It's a great time to go back and say, am I really using all of the steps of relaxation that have demonstrated to be effective? It's a prompt. It allows you to reflect afterwards. And again, it allows supervisors to evaluate how their folks are doing. Anatomy of a practice guide, just showing you kind of name, when you use it, who it's for. It has steps, and then it has details to each step. So I'm not going to go through that a great deal because I fear we'll run out of time. So we have practice guides. Then briefly, I just want to say that when you're trying to do a 1-hour presentation, we have a 40-hour training on what we call MAP, Managing and Adapting Practice. And over 40% of the cases in LA County are being billed as MAP right now. So we train folks for 40 hours. They do 6 months of consultation with us every other week. And then they turn in a portfolio and a couple of dashboards for a couple of youth they're seeing to get a MAP therapist credential. You don't have to get a credential to use this. Let me make that very clear. But for them, it is required that they do some type of evidence-based program, of which MAP got on their list, even though it leverages all of these evidence-based programs. So I just want to say that sometimes it can come across sounding fairly simplistic, and it is, but we also have not just those practice guides, but we also have process guides or coordination models, decision-making models. How do I use those sources of information and evidence I talked about at the beginning, right? Like, how do I use that to sequence and put together those practices? So that's just a quick reminder of that. So then in COVID, in our world, we would be asking, questions like, do you continue with your original plan? How will you decide? What evidence will you use? How will you deliver the practice virtually? Anyone been asking that and having to pivot and change and try to figure out, how do I do exposure with the youth when they aren't right in front of me? How do we do activity selection via a computer? So we've been helping a lot of practitioners just kind of problem solve that and think through that using the coordination models, those process guides, but also going back to PWebs and saying, what does evidence-based treatment tell us about disruptive behavior if that's a target? What does it tell us about anxiety if that is your current target, etc. So recipes matter a lot. It's one of the things we say. We've got the ingredients or the practices, but we also teach those recipes. So MAP, I just want to make a quick note that MAP, Managing and Adapting Practice, is a system that we train in. We also train in MATCH. If you haven't heard of MATCH, is like a proof of concept of MAP that can be put into a protocol form and tested in a randomized control trial. So that was tested and demonstrated to be effective. So you're probably asking, like, how does this, why is she coming here and telling me about all these resources? How does it relate? Again, in our world, we've been talking a lot about those coordination models of focus interference framework. How do I select a strong focus? And then how do I identify evidence-informed resources, evidence-based resources for what I do when I have things that could interfere with my plan? Things like COVID. If I'm working on anxiety, things like disruptive behavior. It helps us really think about what are our treatment targets and how can we sequence practices and online in the current environment. How can we engage parents? PWebs helps us get good ideas and have access to resources. So some of which are free. Stay tuned. I promise I'm getting there. Curious right now. You guys are probably seeing all of this. Yes, some anxiety, depression, disruptive behavior, trauma's increased. Unfortunately, it's incredibly sad. Kids and parents are home. It's a stressful situation. So I'm guessing we're probably all on the same page there. So I thought I would just pull up a little example to try to apply some of what we do and some of the resources and how they work and how they might be helpful to you. 14-year-old living in single parent household, 2 siblings, pre-pandemic, was B student, needed teacher accountability to complete assignments, enjoyed being with friends, motivated by sports. Sound like some of the kids you guys have seen? Life was okay. Post-pandemic, or I should say in the middle of pandemic, grades declined, doesn't hand in homework. You guys seeing kids like that? I'm seeing them everywhere, family, friends. I'm hearing about this a ton. Increase in parent-child conflict, a whole lot of together time, increased apathy, only pleasurable activity video games. We do an activity with activity selection in our training, how to generate activities that can't be video games. Poor sleep hygiene. Sound like some of the kids you guys are seeing? I'm guessing.
Sounds like some adults too.
Yeah, exactly. Well, and that's one of the things I would say. I'm glad you actually said that. I think that was Emma. Oops. Important to note too that the MAP system works for youth or adults. It's just the PWebs right now is coded in comprehensive for 0 to 18. We're currently coding the transitional age youth literature. So that's actually going to be published not too long. We're going to have some of that starting to come in and feed the PWebs. PWebs is updated every 6 months. Also just want to point that out there. So you're absolutely right. Adults are having a lot of these problems.
And Dr. Bourdeau, do you mind just clarifying again what MAP stands for? I just want to make sure that I told somebody correctly, but actually, and then also match.
Yes, exactly. I'm sorry.
Yes, please spell out the acronyms again.
Yes, absolutely. So managing and adapting practice is MAP. Managing and adapting practice. And MATCH is the modular approach to the treatment of children who have anxiety, depression, conduct, disruptive behavior, and trauma. MATCH, ADTC. So the first randomized control trial tested anxiety, depression, and conduct. And then they added trauma in the next randomized control trial. And that was called Child Steps, that research. Thank you guys for asking and for slowing me down.
Yeah, so I'm sorry, just say it one more time for, I thought match was MA.
It's MA, modular approach,
Okay.
to the treatment of children with anxiety, depression, trauma, and conduct.
Okay, thank you.
Yeah, you bet. All right, so kind of going back to our youth that we're seeing, you know, you got, and I think I said 14-year-old, but let's say I search P-Webs for depression, 15, either gender, because it doesn't matter. I think the literature is probably pretty robust for both and depression. Level 2, good support or better. My current search got me 43 papers and 55 protocols across those 43 papers. Okay, that's the context for what I'm about to look at. And then what I see is a list of practice elements that came up. And I can see that I've got, you know, cognitive and 64% of those, psychoeducation, child 64%, activity selection 53%, problem solving 50%. Are the top ones more important? Not necessarily. Remember that all those sources of evidence, it may be that the youth I'm seeing is having the caregivers having some real struggles, and I've got to go down there to caregiver coping, which was used in 8% of those. Or maybe it's, you know, self-monitoring. I got to get them to tune in and monitor their own mood and their own behaviors as it relates to their mood. Again, we kind of teach that sequencing is really dependent upon multiple evidence bases. So selecting practices that will work for this youth, you know what, the P-Webs was a good place to start. I'm going to consider it with other evidence bases like pandemic context. Is this just related to pandemic? Is this pre-morbid? What can we do to try to help them get back on track when school's back in face-to-face? Causal mechanism, what do I know about attachment? What do I know about reinforcement and learning? You know, what do I know about social learning? What am I seeing in other youth in my practice area region? How's that helping to inform what tends to be working with the youth? This specifics youth ecology, environment, symptoms. So what I've decided based on all of these evidence bases is that I'm going to choose psychoeducation to connect with this youth and this family for depression. I'm also going to teach self-monitoring because I think it's really important for the youth I'm seeing. Then I'm going to go into activity selection, and I'm going to do cognitive because I really want to get that behavioral activation. I want to get that up, increased, and get them involved in some more pleasurable activities, as well as doing cognitive. So my treatment plan may look something like this. I also recognize this youth has some disruptive behavior and is fairly non-compliant with parent requests. So I'm also going to introduce praise to parents and a reward system to try to increase, you know, successive approximations to a target positive behavior, and help this parent manage that disruptive behavior with that youth. So one of the questions I says, how do I do activity selection like the evidence-based protocols did? Well, I can look at those protocols using activity selection. If you know those, you've got those, you learn things in graduate school, you've attended a CE workshop, you've attended seminars. We have practice guides, I already went through those. Then we also have PracticeWise online videos. Ready, guys? This is pretty amazing. It shocks me still when I say it, for free. I'm not lying. There's like there's no catch with that. Like it amazes me as well, because a lot of work and expertise goes into creating these videos. We have practice guides you pay for, and they're like less than $1 per guide. But then we have these videos. You can also take the videos for continuing education for what we call like a freemium. You know, it's like a small price to get some continuing education, but you can get these for free. So I just wanted to show you guys an example of that. I think it, yeah.
A quick, Laura Mahler, do you have a question? I see a hand virtually raised.
Thanks, Emma.
Okay, I guess that's.
It's gone now. I think that was in response to an earlier question.
Okay,
I'm so sorry.
It's okay, just making sure. All right, go continue. Sorry for.
I'm so thankful. No, I'm thankful for you guys helping, because there are a lot of things on my screen. So I apologize to anyone I didn't see the hand raised.
No, yeah, I was just making sure, especially since you're talking about the free resources part.
Yeah, sure. So I just wanted to show you, I pulled some of the slides. These are, they have audio to them. So someone's speaking and talking to you about these resources. I'm clearly not going to do that while I'm talking to you. So I'm just going to show you what the slides might look like. And then you can imagine that someone is basically walking you through a script about the slides. So we have video resources for practice guides, and I'll show you a list of those in a moment. And for those process guides I talked about for free, you can go look at Focus Interference Framework. You can look at Connect, Cultivate, Consolidate. You can look at the evidence-based service system model for kind of case conceptualization, how to pull those multiple sources of evidence together free. And we have them in 3 different versions, at least for each one. That's in Bloom's taxonomy of knowing what it is, and then a closer look, or that understanding module. And then we have an in action or application. So the one I'm showing you right now is the a closer look. Okay. You do not need to purchase anything to get free videos. Let me make it clear. When I say free, there is no catch. This is not bait and switch. All you have to do is go sign up for an account so that you basically agree to the terms of service, what you will or will not do with the videos. That's it. So good question. Thank you. So the one I'm showing you here is the understanding Bloom's taxonomy, closer look. So most of the videos have like a review of what you saw on knowing. What's the theoretical rationale behind activity selection? How do we explain activity selection? What are the types of activities? What are the categories or buckets of those activities that are effective? What are other practices that are related to activity selection? And then we talk about activity selection essentials. So I'm, again, given the time, I'm going to try to take you through a few of these slides so you just get a little bit of a glimpse of what they are. So again, you get the review, theoretical rationale, how you would explain this to folks. So like for the youth, how can you explain it to them? How could you explain activity selection to a caregiver? How do you explain it to a teacher? How would you explain it to a health professional? That's in all of the videos. We talk about why would we use this? How can this be helpful? The type of activities, the buckets or categories of those. Related practices. So you often might use activity selection with self-monitoring. We might want to get ratings of use behavior before and after the activity, of course, to see, was that an effective one for you or did that not work so well? Psychoeducation about why and the behavioral activation, problem solving, cognitive, etc. This talks about the essential steps of it. It gives a case example, youth example. So one of the things I was just going to point out, it's one of my favorite things for teaching and training. For trainees, supervisors love these, instructors love them. Here's like an example. Here's like the first step. And then it says, okay, let's talk about the first example. So I talked to this youth about it and said, oh, today we're going to talk about activity selection to help improve your mood. What are some things you think you'd like to do? And it says, yeah, that's not really, that needs some improvement. So then we say the kind of rationale. Today we're going to talk about doing things that can make you feel better. You're almost there. You're getting better in your explanation. And then it talks about that plus scaling. So what the videos do is they go through specific examples where it's like, yeah, it's a little bit higher quality. Now you've got all the essentials in there. So it does that for all parts of, you can see it goes through like, hey, you're almost there, and then recommended. So I'm gonna zip through that so we make sure we have time for questions at the end. And I talked to you about a couple more free resources. So this would be the recap just for the online course. Just want to point out, we have those. I have a whole list at the end of this. I'll click off the PowerPoint and I'll show you our entire list of the free resources. Like I said, if you go to PracticeWise and you set up an account, you can also go to My Courses and you'll see the entire menu. So anybody here, faculty, do training instruction in any large agencies, have a training department? Don't want to waste anybody's time if no one's interested in the faculty type instructor resources. Anybody teach?
Yeah, I'm seeing some virtual hands. I think
okay, thank you. A little
bit shy, so there's some in the room.
I can't see the virtual hands, so I'm so sorry. I don't know like where those are coming up, but thank you very much. So let me just briefly then tell you, I've got a slide. We do have a MAP faculty and a MAP instructor. You can set up a MAP faculty account, free to register for that. You do get a 90-day trial resource subscription to see how they might fit with your course. And if students sign up for student subscriptions, 5 or more, you will get, it's kind of like getting your free textbook in a sense. Definitely less expensive. We have many instructors out there that assign the database and the practice guides as one of the resources they have to purchase for the course. And then they build it into their syllabus. And we do have sample syllabi for how to teach some of this in a course. And it does not require a credential to have that. We recognize lots of people are expert in lots of these practices. We're not suggesting you have to become a MAP therapist to be expert in those. MAP instructor, on the other hand, is a way for professors to give course credit like we do in our trainings, but to give it through the university, through your course. You will get all those slides I just showed you for all those process guides and practice guides. You get them free. Again, no hook, free to incorporate into your presentations. And you get a MAP instructor credential for free by watching a 1.5 hour video that just says what you will or won't do with those slides. And then students can gain hours for any of the content that you teach in the MAP direct service curriculum. So what I would say about that is that if you guys haven't gotten the sense that, you know, if the people who, you know, if we could give it away, we'd give it away. But what we learned was we're built for impact, not empire. But you realize to have impact, you've got to pay for it to grow and be maintained. So that's in the subscriptions and the training, the consultation. We have lots of publications that are, you know, by the developers of this, by lots of other folks outside of the PWebs, you know, references. We actually have other publications and references that you can see on our publications page. That's a little bit of a snapshot of the top banner where you can see the services you've subscribed to if you attend any of our events, those My Courses that are free to you. If you are a MAP faculty, you'll see that under My Roles. So agenda recap, here's where we are. I hope that you got some sense of evidence and why evidence, and one evidence-based resource. We walked through the PWebs, the database. Hopefully you got a little sense of the toolbox and some of those coordination models and the practice guides and the online video resources. And what I would say is it's only just begun. It's been an hour of a presentation. So much more to come with HGAPS in their presentation in the fall, like Eric said. So much more to come post-COVID and what we're going to learn and research there, how to help kids. So do folks have questions for me? I want to make sure that I stop, get questions, comments, reactions. I can take it. The virtual clap. Thanks, Eric.
Yes, thank you.
And we have virtual clapping.
And Diane had a question. Yeah. I think Diane has to, we have to take her off mute maybe. Diane, did you have a question?
No, I did not.
Okay.
I see one in the chat from Kathy Yates. She said the focus was children. Do most of your comments relate to adults as well?
Such a good question. So the PWebs is 0 to 18. The coordination models absolutely apply. You could do focus interference framework with adults, connect, cultivate, consolidate, evidence-based service system model. What you have to do is replace the PWebs right now doesn't cover the adult literature. So you would be replacing that with, you know, adult meta-analyses on depression or anxiety or Cochrane review or, you know, your own research, you know, your own reading of the literature in those areas. Good question. Practice guides can be adapted too. I mean, I many times use different practice guides with the adults I saw because relaxation wasn't too far off. I just might use a little bit different terminology or wording with the adults, but cognitive for anxiety, cognitive for depression, psychoeducation, true alarm, false alarm worked quite well with adults for anxiety as well as with the kids.
Does PracticeWise concentrate, and PWebs, do these resources concentrate mostly on psychotherapy and things that psychologists and counselors and therapists would do, or does it also look at medication and alternative treatments, or things that the public is curious about, like CBD oil? Will that fix everything?
Yeah, good question, Eric. It's definitely psychosocial treatment literature. You will, if you search PWEB, see studies that included, if they did CBT and medicine, for example, it will show up in the database, but we don't do a comprehensive review of medication only. We do create a blue menu for the American Academy of Pediatrics, who includes the blue menu from our updates every year as a part of their mental health toolkit to inform their providers on mental health treatments that have been demonstrated to be effective.
I've never heard the term blue menu. What?
They call it the blue, it was called the blue menu a long time ago. If you're on AAP, I think they now call it the psychosocial table, intervention table. And it's basically a static kind of printout of PWEBs, a yearly static printout of the treatment families for the different target areas. And you will notice they don't put attention on there, even though we code it, because of all of the medication, all the trials that do use medication, and those aren't all, of course, in PWEBs.
Also, Christina, did you have your hand raised?
I did. I was going to check to see, you kind of mentioned PCIT, and I was wondering about basically parent-focused interventions, like, and thinking of it in terms of child problems versus whether or not the parents are having a problem that might impinge on the child. So I was just kind of curious about it from a family perspective.
Yeah, I appreciate that. And I'm sorry, I don't know who spoke up, or I would say your name, but appreciate the question. You are correct that in the PWEBs right now, if it's youth focused for the most part, like youth targets. So if it was a parent target, it wouldn't be coded in this version right now. And the PWEBs will continue to grow and get some of that. But I think part of what you're saying is we definitely, all of the treatment studies that have measured a youth target that included parent interventions are in there. But if it was a parent specific target they were focused on, it would not be comprehensive for that.
Okay, thank you.
Yeah, you bet. Good question.
And we have another question in the chat from Earlise Ward. Will PracticeWise eventually move to adults? And I think you kind of touched on that, but if you want to elaborate more.
I'll just say what oftentimes I think the developer said is, like, we have so much work to do in the child mental health treatment literature and training people and getting this out to folks and continuing to update and code this literature, which is an ongoing constant process. So yes, I believe actually, I think it's, I don't think we'll go back in treatment research, and I believe it will be extended to adults. Will it be in my lifetime? I'm not sure. Other questions or comments, reactions, wish list?
Did you, can you touch on, let's say that we are aware of a article or a resource that we think is like a good quality one. Can we suggest it to be added to PWEBs?
Yeah, great question. So we aim to have comprehensive coverage in there. And if you feel there's one that we do not have, you absolutely can submit it to either support@practicewise.com or nominations@practicewise.com, because occasionally things can be missed. We're currently going through an article surveillance, going back a few years to just make sure we got all of them. What happens sometimes is absolutely yes, you can, and we will put it in the queue to be evaluated to see if it meets the criteria for studies currently in PWEBs. Sometimes people say, oh, something's not there, but then when we go to have the review team look at it, we'll inform that, well, it didn't meet the criteria as we are coding them right now for PWEBs. But yes, absolutely.
And so the email address to email that citation would be support@practicewise.com?
Sure. Yep. We have nominations, but support gets, if you email support, if you ever have questions, they'll get it to the right person. And somebody said, how do you arrive at a quality grade for the evidence? Great question. Again, Division 12 established criteria about studies at level 1, level 2, level 3. If you watch the PWEBs video online, it will do a much better job of describing that in the 1 minute I have left than I could possibly do justice. I would be afraid to go on recording trying to say, but you absolutely can see it there. And I invite and welcome questions at any time. You know, email me anytime.
So,
yeah.
So Teri, thank you so much for letting us record the talk. And we're going to put that up on the HGAPS YouTube channel. We'll also mail the link to everyone who attended tonight. And that YouTube link is going to be free and free for you to share with other friends, other colleagues, watch over and over again. Did you have any other materials that you wanted us to share along with that? Copy of the slides.
Oh, I do have I will actually include, I did say I'd show you, and I apologize we didn't have time, the comprehensive list of the the courses. So I can do that. And the only other thing I would say is, Eric, there may be a couple slides that when we go through a new recording, I may go back and just cut because they're, you know, paid for resources, a couple of the ones I included in there.
Sure.
I'll chat. I just want people to know you can absolutely access things, but may have to cut a couple of those out before we post it.
Yep, completely understand. So, all right. So that was wonderful. Everyone, we have 78 people who signed in for continuing education. So this is me now in the guarding the door. Let's have 78 people sign out, and 78 people also do the learning assessment. So next to where you signed in, if you could type your name again, and then the URL, if this were a game of Battleship, the URL in B7, which is bit.ly HGAPS 1 CE for 1 hour CE, number 2, second time in this series that we're offering it. If you click on that, that'll take you to the learning assessment, which which has the learning objectives and other if you've done a CE before, you will recognize it, all the usual questions. So 78 people signing out, 78 people hitting the learning assessment. It's going to ask you for your name and your email again. This is redundant, and we're trying to make sure that the technology works at least once, as long as ideally everyone's going to do both, but as long as you are, yeah, we're going to make it work. So that is it for the housekeeping. Hope to be able to do this again in the fall with another speaker series. Thank you a ton, Teri, for taking time out of your schedule to do this. That was great.
Thanks for having me. I'm thrilled to be here.
And thank you all for coming on a Monday night for yet one more Zoom on top of all the other ones that you did today. It was wonderful to be able to share this information. And as I look at the emails, literally all over North America. So thank you all for coming.